I'm Melissa Gibblets. I'm the Rehab Director for the Jewish Home of Eastern Pennsylvania, along with Elon Gardens. Today, I'm going to be speaking to you about stroke. But first, I want to give a shout out to all the speech and language pathologists out there. May is Speech and Language Hearing Month. So we want to thank everybody for all your hard work and everything you do for our patients. This is a great way to tie in the stroke because speech language pathologists may help a patient get along through their treatment, especially if they had a stroke. So let's get started. Let's do stroke 101, so to speak. Stroke is a brain attack, cutting off vital blood flow and oxygen to the brain. In the United States, stroke is the third leading cause of death, killing about 137,000 people each year, a leading cause of serious long-term adult disability. Did you know approximately 55,000 more women than men have a stroke each year? Men's stroke incident rates are greater than women at younger ages, but not older ages, something to keep in mind. Not only that, but the prevalence of a transient ischemic attack, TIA, increases with age. Up to 40% of all people who suffer a TIA will go into experiencing a stroke. So what should you do when a stroke strikes fast? Well, you should call 911. Common stroke symptoms include sudden numbness or weakness of the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking, understanding, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and sudden severe headache with no known causes. So let's talk about our risk factors and then what you can do if you suspect signs of a stroke. Going on to those risk factors. High blood pressure is definitely one. You are at a high risk of stroke if your blood pressure is anything over 140/90. If you do not know your blood pressure or what it's typically at, you can certainly get that checked by your doctor. High cholesterol is another big factor. Your LDL cholesterol, the bad type of cholesterol, should be under 100. And your good cholesterol, which is your HDL, should be over 50. Diabetes is another risk factor. If you smoke, that is also a risk factor because it tightens the blood vessels and increases blood pressure. It is a major cause of stroke, and it makes your blood more likely to clot. A sedentary lifestyle. I know we might hear this 1,000 times, but anything helps, even just walking, just to even help, again, those risk factors be mediated for a stroke. Family history, along with your gender and your race, are important factors when considering if you're at risk for a stroke. So when you're not sure, is it a stroke? What is happening to me? It's scary. You might be afraid to call 911 because what if it isn't needed and you don't want to, call them unnecessarily. Sometimes people think of that. Whatever it is, and if it seems like it might be a stroke, you have to act fast. Don't worry about if it wasn't a stroke. You have to save your life. So if it's a stroke, I want you to remember exactly that. Fast. F for face, A for arm, S for speech, and T for time. So what do I mean by that? Well, if you notice that one side of your face is drooping, it can even be like look uneven, feels numb. That could be a sign. Again, your arm. Does your arm drift downward? Is it hard to raise both arms in the air at the same time? That is also a factor. Speech. Is your speech sounding strange to you? Maybe someone says you sound like you're slurring your words. Is that a sudden onset that's not typically for you? And time. Every second counts. Do you know that every second that goes by, your brain cells die? Every moment of that minute is so, so important. So you want to act fast. Again, your face, your arm, your speech, and your timing are really, really important. Well, I hope today we were able to help you notice the risk factors, the signs of a stroke, and unfortunately, if you do feel like you're having one, you now know what to do. Act fast. Face, arm, speech, and time. They are of the essence. Again, I'm Melissa Gibblets, and I represent the rehab department at the Jewish Home and Elon Gardens. We are so happy to speak with you today and bring you more knowledge and information to help your quality of life. Until we talk again.